day. Did you sleep well? Can you tell me your name? Wilma Smith. Wilma Smith on her bracelet. Can you tell me your birthday? Okay. 2 identifiers to make sure that you have the right patient. Okay. Sanitize. Glove. 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 I'm Brittany. I'm a nursing student and I'm going to be helping you with your oral care today. So you would ask the patient what you think that he or she is capable of doing. If they feel that they are capable of doing it all, then you would have the supplies sitting on the table and you would just place it in front of them. You would place a towel on their chest so that they don't get wet, and you would raise the patient to a degree that they won't aspirate while brushing. Also be mindful that if your patient does not have upper body strength or sometimes medications to where this patient might flop forward and hit the table, you just want to know, be mindful of that. So if this patient could do everything themselves, then I would have it set up here and then I would just observe. If this patient needed minimal assistance, then they may need the toothpaste on their toothbrush. They may need me to floss their teeth, and then you would want to offer to see if they want mouthwash or not. So this patient needs minimal assistance. So do you want me to do minimal or no? Okay. So I would put, if I was brushing this patient's teeth, I would put the toothpaste on the toothbrush and I would begin brushing from back to front and from the gum line down to the molar or to the bottom of the tooth. And after I would finish, I would offer the patient water and put the basin to their mouth so that they could spit. I would then floss their teeth because the patient should have their teeth flossed 1 time daily, and offer water and spit in the basin. And if the patient did want mouthwash, I would then give the patient mouthwash and then allow them to spit. And then I would thank them and remove my gloves and wash my hands and leave. If this patient had dentures, we'll show you that in a moment. If this patient were unconscious, the bed would need to be flat, which may take a moment. Also, if this patient did have dentures, you may want to still offer mouthwash whenever you remove them from their mouth. Sometimes it can, if they, between the dentures and the hood of the mouth, they can get, food particles or, just to allow some refreshment to their mouth. Okay, so if this patient were unconscious, I would lay the bed flat. I would roll the patient towards my body. Lay a towel down just to make sure if there was any spillage that it would catch it before the bed would. I would place the basin under their jawline to catch any fluid that would spill out of their mouth while I'm brushing. I would have toothpaste on my toothbrush prior to rolling the patient over so that I can still hang on to them while I'm doing what I'm doing. I would brush inside of their mouth. I would make sure I had suction also. That's very important so that the fluid that you put in is also sucked out through suction and not down their throat. So I would brush their teeth from back to front and from gum line to the end of the tooth. Rinse, suction. I would also floss the patient's teeth, rinse, suction, and mouthwash. Did you do mouthwash? Maybe? No? Probably not mouthwash.
You could use those.
Also, for a patient that is unconscious. Every 2 hours, you would need to come into the patient's room with a sponge. It's best to do that at the same time that you're rotating a patient, since you should rotate an unconscious patient every 2 hours to prevent bed sores. You would also want to use the sponge whenever you came in to do that. You would take the sponge around the exterior into the cheek on both sides, and you would never stick this between the teeth in towards the tongue, because they, as a reflex, will clamp down on it and then you won't get it back out. So then I would roll the patient back away from my body. Make sure that they're covered. Make sure that their pillow is in a good position. Remove the towel, and then you're finished.